Hi everybody, Dr. Kristine here at Every Family Chiropractic Center. Today I want to talk to you guys about the thyroid because there are many patients who come into this office, and while I'm talking to them and getting some of their other things that are going on that are not pain related, a lot of times I'm really strongly believing that they have some thyroid function issues. And many times I will ask the patient, have you ever had your thyroid tested? And they'll say, yeah, I got my thyroid tested with my PCP. Nothing's wrong. It's all good. And my goal here isn't to tell you not to trust your medical doctor when they do your thyroid testing, but it is important to know that many doctors are not taught to do thyroid testing the way that people who learn more nutrition and learn more about the more natural healing learn to test the thyroid. And basically the information that I'm about to tell you is from a medical doctor. She is one of the leading women in natural women's health and pregnancy. Her name is Dr. Aviva Ram. And I really like her information because her background is actually more natural. She was an herbalist for a long time, so she really understands nutrition. She understands the body and how to treat things naturally. And her specialty is the thyroid. And the reason why is because she's also a midwife and very big into pregnancy. And she realized that a lot of issues with infertility are actually linked to thyroid, therefore leading her down the path to helping people with their thyroid dysfunction. So the thing with thyroid issues is it's estimated of up to 1 out of 8 women actually has a thyroid disorder, and it is very highly underdiagnosed within the medical world. So if you go to a medical doctor, DO, MD, very often you're going to be told that you don't have a disorder when you actually do. Sometimes if you go to the functional type of docs or naturopaths, you might actually be overdiagnosed with the thyroid disorder. So at the end of this, I'm going to give you her exact podcast that I got all of this information from, so that if you want more detail about thyroid testing, you can go ahead and listen to her podcast, and then that will actually lead you down some other routes for her, more information on what to do if you have a thyroid disorder. But basically, I have a little chart here because I just want to go over this quickly with you guys. The main things that people get tested for when they think they have a thyroid disorder are TSH, T4, and T3. So the issue with TSH, this is your thyroid stimulating hormone, and this is my little picture of the thyroid because the thyroid looks like a butterfly. It's right here. Um, Thyroid stimulating hormone is one of the first things that people will check if they think that they have a thyroid issue, because the level, your thyroid needs to your TSH needs to stimulate your thyroid enough to create T4. So one of the first things, well, let me find a marker here. One of the things that I want to make sure to mention is that this number used to be normal at a range of 10. That has been cut back to about 4.9 or something around that range for what is normal. So they say now normal is 0 to 4.9, I believe. However, people who have no thyroid symptoms whatsoever, their normal is around 1.5. So a lot of endocrinologists and people who really dive deep into the thyroid actually think that if you're near this number here, you do still have a thyroid disorder. So if you had your TSH checked and you're up in the 4 range, you still probably have something wrong with your thyroid. Another thing to check is sometimes they'll check your T4 and your T3 and say that those numbers are normal also. However, it is very important that they are checking free T4 and free T3. So a lot of times, if you have had these tests done, you can go back and look at your results. Make sure that your number is actually, I'd say you want to have your number below a 3. And then make sure that they actually checked for FT4 and FT3. So free T4 and free T3. And the thing is with thyroid disorders also, your TSH levels are not the end-all be-all for a thyroid disorder, because you can have issues at any of these levels. So say you have say your levels of TSH are in normal range, there's the chance that your T4 is still not high enough because something's going on in here that's not converting to T4. There's also the chance that your T4 is not properly converting into T3. So that's why it's important to check all three every time. Don't just do TSH. So if you've ever had your thyroid checked, you need to do TSH, free T3, and free T4, all three of them, because an issue can show up in any of these areas. Once you find out there's an issue here, there are other tests that can be done to find out if you actually have the autoimmune disorder Hashimoto's. I'm not going to go into those because this is your first route. So I just wanted to make sure to talk to all of you about that because I also realize that thyroid disorders are an epidemic right now in this country because of all the toxins that are affecting our thyroid. And if you believe that you have a thyroid disorder, if you're struggling with constipation, brain fog, low energy, if you have recently gained weight and then you can't lose it, if you have some depression or achy joints all the time, a lot of times these are linked to other things. That's why people don't believe that you actually have a thyroid disorder, but these can also be a thyroid disorder. It's not a big deal to get these tests done. You get some blood drawn, you get all these levels taken. Feel free to ask your doctor. You know, a doctor should be willing to listen to you. If you have a good relationship with your doctor and they're telling you, nope, you're crazy, go to a different doctor. No doctor should ever tell you that you're crazy. They should be empathetic. They should be listening to you because you know your body the best. So if you think you have a thyroid disorder, go back. If you've already had the test done, make sure that these are the ones that you had done. And if they weren't, go back and say which ones you actually want taken to find out if you have a thyroid disorder. So I wanted to make sure, and I'll put this in the comments also, to give you Dr. Aviva Ram's information. Her podcast is called Natural MD Radio, and this is episode 118 that she talks about this. It's pretty short. It's only about 20 minutes, but she goes a little bit more in depth on some of the other tests that you can do. And then she also has a printout available because she is very passionate about this, and she does not want people being underdiagnosed with thyroid issues because it creates a big effect in someone's life. A lot of women who fix their thyroid, their depression goes away, their brain fog clears up, they just have a lot more energy and life improves substantially. So don't just ignore it. Don't just take your doctor's word for it. And if you do want to get tested, and make sure you ask for these things that I'm talking about: TSH, free T3, and free T4. So I hope that this was informative for you. It's something I'm pretty passionate about because I hate to see all these women, especially post-pregnancy, which is a lot of times when this will show up, really struggling. So go ahead and check out the podcast that I'm going to be posting in the comments, and I hope you enjoy it, and everybody have a fabulous week. Bye.